we're talking about going to work when you're sick, what that means for you, for your employer, for the economy, and for society as a whole. And with me today, I have Professor Gary Johns of Concordia's John Molson School of Business. He's done a study on this very issue. And also with me is Gina Rizzo, who works at the MUHC, the McGill University Health Center, which includes the Royal Vic Hospital, the General Hospital, and the Children's, among others. Welcome to you both. Thank you very much for being with us. First and foremost, Professor Johns, can you define, because I had never heard this word before, what is presenteeism?
It's been used to refer to going to work when you're ill.
Okay, so how ill do I have to be considered in this? If I have a cold and I go into work, is that considered presenteeism?
Yeah, I think it would be. That's kind of an acute problem. So there are varying degrees, but if you self-identify as being ill, I think it's grounds to call you a presentee.
Okay, good. Gina, had you heard this term before?
Interestingly enough, and I work within human resources, it was a foreign concept to me. You know, you hear the term absenteeism, and we're very familiar with that. You know, we can measure absenteeism. Presenteeism was something relatively new, and in fact, thank you, Professor Johns, because you uncovered a rich world of information for me, and something that is now in my mind, and just wondering, okay, so where do we take this?
All you need is another managerial problem, right?
I must admit, it does add to our list, yes.
So you may not have heard of the exact term, but the concept of going to work when sick, when ill, I imagine you are very much in touch with. And is this something that you discuss very much in your hospital settings?
Well, that's interesting. The concept we definitely hear of, because not only do we hear of it, we live it, right? I have employees, and they are sick at times, and they come in, and you don't even realize, in fact, I think it's interesting, you don't even think that it's a concept. Is presenteeism a concept? So until I started reading about it, I'm thinking, wow, it is a concept, and it is something it's maybe not as old as absenteeism. Would you agree?
Yeah.
The literature is kind of young.
Yeah, absolutely. We haven't paid much attention to this in the past, although it's kind of interesting because this has obviously always been going on since the advent of work. And yet only recently has it kind of captured the imagination, particularly people in occupational medicine, but now coming into management and organizational behavior, we're seeing a profound interest in this.
Right, because when I read your research, I thought, oh my goodness, we've lived this forever.
Yeah,
we've never talked about it. It's not something that organizations, at least not in my experience, necessarily have a plan to deal with.
Absolutely.
It's there, but I guess the question is, you know, how do you deal with it?
One of the reasons I think is absenteeism is easy or relatively easy to measure, not showing up for scheduled work. When it comes to presenteeism, the measurement of this and the documentation of this is much more difficult. So it's a more slippery concept from that point of view.
Absolutely, and one of the things you endeavored to achieve was to measure presenteeism. So how did you go about measuring it?
Well, there are a lot of ways you can measure presenteeism. Some of these measures are more complex and some more simpler. Almost all of this has to be self-report. It has to be people telling you about this because it's kind of a hidden variable. It's hard to see this. It's not like absenteeism where you're there or you're not there. You're there, and you may even have motives to kind of cover up your illness. Maybe you're depressed and you don't want the boss to know this. So it's hard to do this, but typically there are questionnaires that ask about this. In some versions, the typical medical one is, it kind of asks you, it gives you a bunch of kinds of illnesses such as asthma, back pain, so on and so forth, depression. It has you check off any of these, and then it asks you to kind of estimate how this affects your productivity. The other version that I've also used is, we want to know how many days people go to work ill. So we'll choose a relatively short time frame, like in the past 6 months, can you estimate how many days you went to work when you were ill, when you were under the weather, when you probably really shouldn't have gone to work? So here we have the latter measure being the act of presenteeism. And then a question downstream is, how much did this affect your productivity? So those are kind of related issues. Do you go to work sick? And then what happens on the job as a consequence of this, either to you or to maybe your coworkers if you're contagious. But so those are the two ways, kind of asking people to estimate how many days they've missed in the past few months, and then asking them how much this affects their productivity.
Very interesting. So we'll talk about your findings in just a moment. I just wonder, what type of people did you evaluate, did you survey?
My research, there's been a good bit of research on this subject, but my research used actually their John Molson School of Business graduates. So these are all people who are out in the workforce that either have bachelor's or master's degrees, MBAs, from Concordia. So there were over 400 of these people, and we used a web-based survey. So these people work in the full gamut of places you could expect business school graduates to work. Any place you might imagine a business school graduate working, these people work. So from that point of view, given the fact that they all do have degrees, it's a pretty broad sample occupationally.
So when you ask them, sorry, you wanted to
Well, I just wanted to say how it's so interesting that there's this presenteeism phenomenon now that's a little bit more out there in the literature. And as a manager, because that is my role, I need to be aware of that. I think that's maybe one of the things that we need to do before we even consider measuring, because if organizations are not aware
Absolutely.
of what presenteeism is, I think they know, they intuitively know and perhaps know the implications, but not fully. So is that something, and as a manager I'm thinking, wow, it just increased my awareness of presenteeism. So when I went into work this morning, that's what I had in mind, and I'm looking around and thinking, wow, not only are some of the employees perhaps living that, but I know that I've lived that at times where I just didn't feel like going in for whatever reason. There are things happening at home, an ill mother, a child not well, yet I was there. And is that maybe a way to even begin to introduce the topic of presenteeism in organizations that are perhaps not even aware of what it is?
Yeah, one of the nice things about researching absenteeism and presenteeism is everybody's done it. So it's not that exotic of a concept in many ways, both of them. But one of my goals in doing this research is to bring this subject that's mainly been studied in occupational medicine, trying to find out how much productivity is lost due to asthma, due to allergies, due to depression, to bring this more into kind of mainstream management and organizational behavior research, both to managers, practicing managers, and also to my colleagues, researchers, who might want to look at this in a more behavioral way, this not going to work when you're sick, or going to work when you're sick.
You say asthma, I'm asthmatic. And I can tell you, I've lost very few days of work, because I think there's also this cowboy attitude that you find in the workplace, and I think it's not gender specific. You'll find it in males, you'll find it in female, that basically says, oh no, I've got to show that I'm committed to the organization. And self-sacrifice is equal to professionalism. So I'm going to go in regardless of how I feel. So I think there's this cowboy attitude that's there, and I think you bring it out in your literature as well when you talk about workplace culture.
Yeah, there's been a bit of research that also suggests that men are particularly prone to what you just said, kind of toughing it out, and I'm going to show them, and this is an act of loyalty, and so that even when one would normally be forgiven for taking a day off, being ill after a long business trip, something like that, qualitative research shows that there are some cultures where this becomes a sign of manlyhood or a sign of commitment, whether you're a man or a woman, to the organization.
And I
Showing
want
your
to come
stuff.
back to all the different reasons why a person would decide to go to work when they're sick. There are some internal pressures, external pressures. I'd like to talk about all those. But first, if we can just get straight into the results of your research. So when you asked these people, these 400 people, how many days they had taken, what were your findings?
Well, in a 6-month period, if you take the top half and the bottom half, people reported going about 3 days a year. Now the average was 17 days, but that was skewed because there were some people who exhibited a lot of this. But so this is 3-4 days every 6 months. So that's 6 or 8 days a year. And other research shows this. My research didn't probe this, but other research shows there's a lot of variation across occupations in this. And so kind of occupations that are a bit solitary, people aren't so inclined to do this. But we'll get into my research, but whenever there are certain kinds of demands brought on you in certain occupations, including in the healthcare sector, this often happens, we see elevated levels of this behavior.
Very interesting. So let's get into these different aspects that will influence. Job, the type of job that you do. So how would my type of job affect my decision to go to work?
Well, the things I studied were in particular how much significant impact your job had on other people outside the organization. Clients, customers, these could be patients, and that was a big factor. People who perceived their jobs as being significant in terms of direct, immediate impact on others were more likely to go to work ill, were less likely to be absent. Similarly, so those are kind of the external customers and clients. Internally, people who were involved in jobs that had a lot of interdependence, that is, this is teamwork, project work. These people were also very inclined to engage in presenteeism. And this is either because they feel compelled by their colleagues to show up, they feel a lot of social pressure, or they feel compelled by themselves not to let the team down. So those were two big job design factors that showed up. A lot of other research, my research didn't show this, but a lot of other research has shown that ease of replacement also figures in here. If you perceive yourself as not being very replaceable, you don't have any backup, the work will just pile up if you're not there. This is also another compelling job design factor that causes people to show up under the weather.
Absolutely. Does that resonate in a hospital setting?
Do you see my head nodding? Absolutely. If we think of nurses, for instance, we know that there's a shortage I'm saying worldwide, definitely across the country. There's a nursing shortage, there's a shortage of pharmacists, there's a shortage of other healthcare professionals such as physiotherapists, occupational therapists. And absolutely, if there's a shortage of employees and you are scheduled for a shift in one of the ICU units, for example, and you know that there's nobody there to replace you, well, your professional conscience says, what? I need to go in. And I must say, as a manager, I say, well, is there anything wrong with that? Unless you're really sick and you're going to pass on, as you mentioned, the flu, or, when we had H1N1 across the MUHC, we made sure that our nurses would not go in to infect the other patients. But if you're talking about a regular, feeling kind of low, or I'm not feeling really good, employees are going to push themselves to go in.
That's right. A lot of issues.
And I'm glad. And honestly, in some ways, in some respect, we need that, because what are we going to do? How do you justify the shortage and there's a need for patient care?
So would you say that if a doctor comes in and this doctor, let's say she's only at 50% of her full potential, that's better for her to come in than to not come at all?
Well, this is my personal.
No, but it's very interesting.
Let's reverse that question and say, if you had an appointment with a physician and you've waited an entire year for this appointment, and the physician is kind of 50% well, would you tell him, and he give you the option, listen, you can come, you've waited a whole year, I can see you, but I just want you to know that I'm coming down with a little bit of a cold. What would you say? So that's the reality that we're living in.
Indeed, in particular, Swedish research shows that, and English research shows that healthcare providers are these are occupations that report elevated levels of this behavior. Everything from physicians to nurses. So that obligation that I measured directly by measuring how significant is your job impact has been shown in other studies to be very important. As you note, 50% productivity is a lot more than zero, which ostensibly you have, this is arguable, but you're not productive at all if you're absent. Yes. So this issue arises, and there are different perspectives here. I was just at a conference in Switzerland among occupational health people where it was kind of implied by a couple of people that we should do away with all absenteeism and presenteeism, and I said, wait a minute here, that's not at all clear. What we need to do is to get people to manage their health in such a way that they can make informed decisions about these matters. I was famous for a week during the SARS crisis in, what year was that? 2003, I think. Right in the middle of the National Post was on our front page. They interviewed me about this issue. And of course, this was an issue because they had nurses showing up at work during that period, showing symptoms that kind of looked like SARS. And I don't think they were, in fact. But this, on the one hand, showed the dedication. On the other hand, it shows the kind of
the risk.
how people worry about the issue of contagion. And of course, if you read the popular press during the winter months, one of the favorite short articles is finding employees to complain about their coworkers showing up exhibiting symptoms of contagion. So this is kind of the tip of the whole iceberg regarding, symptomology and how it plays out in the social domain at work.
Is that where you would draw the line, for example, in terms of your employees, hoping your employees will come to work? You mentioned before, if you're going to infect others, that's where we draw the line, is it?
I think so, and I think after SARS, I think we learned a great lesson from SARS, at least at our healthcare organization, probably the other healthcare organizations within Quebec. We learned that, although there's a shortage of people, you can't come in and infect others, because then that will just spread. I was reading one article where this happened recently with the H1N1 in I believe it's a CHSLD. And so what happened is the doctor went in and was sick and passed it on to the nurse, who passed it on to the patients, who passed it on to family members. So at that point, you don't have one person who's ill, but you have almost an entire community of people who are ill. So definitely that's where we stop. And in fact, I think organizations have a responsibility to ensure that their occupational health and safety departments are really on top of this, and to put measures in place that if you are ill or if you are exhibiting symptoms such as the H1N1, that you are obliged to stay home. I think at that point it needs to be an obligation that you do stay home. And if you do feel well, I know at the MUHC at one point there was a directive, if you feel well, you need to come in, we need to ensure that you're doing well so that is not passed on to our employees. So there are measures that you can take, but I would terribly agree with that, especially in a healthcare organization where we don't want to pass on the illnesses to other people. Mm-hmm.
Have you seen in the literature companies or institutions taking measures, taking steps to encourage or discourage presenteeism?
No. Most organizations have policies that are written out concerning absenteeism, sometimes in great detail, sometimes not. But most organizations have HR departments that have developed policies regarding absenteeism. I don't know of any organizations, except I'm sure in the healthcare sector, this must be the case, that there must be some discussion about the issue you've just said. But in general, sort of in public companies or in other kinds of work, I don't know of any organization that's developed a conversation about, let alone developed any firm policies or guidelines for managers who are usually in the best place to kind of see what's happening at the ground level. How to deal with this issue.
Which is fascinating, because in terms of absenteeism, there are all kinds of rules. You get a certain number of sick days. You get, this is all in your benefit package. You get a certain number if you're a mother and your child is sick, benefits. Or if you're a parent, or it's all included. But presenteeism, going to work when you're ill, there's no kind of
one reason may be because, of course, we're firmly now into the domain of illness when we talk about presenteeism. This may not be necessarily the case for absenteeism, but we're defining presenteeism this way. And organizations may be a little bit disinclined or nervous to have managers probing employees about their health. So this may be kind of an underlying issue that maybe has made some organizations and managers a little reticent to kind of really take this on and do something about it.
Because it's very much in the notion of privacy.
Yeah, and personal.
You don't necessarily want to tell your employer that you're
That's
sick.
it.
Mm-hmm.
If I may add, you're right. I mean, I think there's more done on absenteeism than there is on presenteeism. And I think also because, as I said, I think the concept is I think people make links, but the concept is not necessarily defined. However, if we look at some, the World Health Organization really is stressing now for the 21st century on workplace health promotion activities or programs. And as far as I'm concerned, I think there's a link between your place of work and the health of your employees at work and job satisfaction or job productivity. And I know that a lot of other healthcare organizations are talking about instituting wellness programs, dealing with,
more holistic.
Exactly. Like for instance, non-smoking programs or exercising. exercising programs and giving the employees the opportunity perhaps to have discounts on healthcare or rather gymnasiums or fitness centers. And I think that there's a link there between putting together these health promoting programs and employee productivity. Can we measure that is the question. I personally believe there's a link. I'll give you an example. At one point, just about a few months ago, we had a coffee break for all of our employees, and we wanted to talk about what we're doing for health promoting activities, and we're dealing with physical activity. And we demonstrated, we had a sort of an aerobics fitness, an aerobics expert come in and just do a demonstration. So we did a 15-minute demonstration on, just a fitness class and what a simulation of what a fitness class would be. And the employees went back to work, and we sort of very informally gathered some information from our employees and asked them, how did you feel after that 15 or 20-minute exercise class? And they said, I felt fantastic and I produced even more at work. So is there a link?
Yeah, well, I think these more inclusive kinds of holistic HR approaches to wellness are going to open the door to allow us to talk about these more specific details, because it's not so much a matter of you're going to work ill, it's a matter of how healthy are you at any given day.
Right. Or how can you prevent?
Yeah, as well.
Right.
Mm-hmm. I think the hospital setting is so fascinating in terms of looking at presenteeism, because there's so many different kinds of jobs in a hospital. There are the caregivers that we talked about, and maybe because they feel irreplaceable, they will feel more pressure to come into work or from their peers. Right. So there are the nurses and the doctors. There are also managers that do more kind of office jobs, and there are the cleaners. There are so many, the pharmacists, so many different types of jobs. And there was a study in 2005, I'm sure you're familiar with, that looked at a hospital setting, and it suggested from the management side, little pressure to exhibit presenteeism, but from the doctors and the nurses, a lot more pressure. Would you say in your hospital setting, all types of jobs, do you see more of certain types of people coming into work?
I think it's fair to say that we need all kinds of people in a healthcare organization, and every job is important, from your housekeeper to your secretary to your professional. But I think we do see a lot more of the professional jobs feeling a lot more the effect of presenteeism than, for instance, a housekeeper who can be easily replaced, and a housekeeper who has very specific and structured job tasks, where the recall list is perhaps a little longer than the recall list to replace a nurse, for instance. So there's less of a shortage perhaps in those job titles as there are in the professional. So yes, absenteeism I think would be more prevalent in those types of job titles versus presenteeism, which would be more prevalent with your professionals, including your nurses, physicians, pharmacists, etc.
And those are the classic job design features that come up in my study, right? And needy patients or clients, teamwork necessitating, or lack of backup. These are exactly the factors that get translated into the occupational level, into this varying across jobs.
And can we talk about the job stability? Because I'm sure even in a hospital settings, there are some people who have long-term permanent jobs and some who don't. And I know that's something that you looked at. When you're in a context where your job is very stable, are you more prone or less prone to go to work when you're sick?
Yeah, the evidence was slightly contradictory about this, because what it showed is under conditions of impermanent employment, contract work and so on and so forth, absence was reduced. Under conditions of downsizing, absence goes up. And yet, both of these, it was argued, insecurity. Now, this doesn't seem right. So I measured insecurity directly. I asked people, how secure are you with your job on a number of questions, a good scale. I looked at that, and sure enough, those who are insecure reported engaging in more presenteeism.
So they're more likely to go to work when they're sick, because maybe they're afraid they're going to lose their job.
Yep.
Yeah.
And that makes sense, right? Practically speaking, that would make sense.
That would make
or
sense.
damage their opportunity to get full-time work, or whatever the particular or damages their chance for a promotion or whatever it is. But those who were insecure, and this study was done kind of during the height of the economic crisis. So I think it kind of magnified people's attention a little bit, especially in this job sector. A lot of these would have been relatively new graduates, although they spanned ages. So there might have been some heightened job insecurity at this time. So absenteeism was down in that study a good bit too, and it's probably just exactly follows from the context in which this study was done.
So insecurity is not necessarily linked to the permanence of your job. Some people may work on contract and feel very secure
like that.
about
So
it.
that's right. That's why I measured this directly, insecurity, because a lot of times they say, "Are you in this kind of job?" But they don't measure, "Do you like this kind of work?" And there's a subset of people who really like that kind of work.
Who like the instability,
Like
who
being
like
independent,
the variety
yeah.
of being independent.
Can choose, pick and choose
Yeah, exactly.
Yeah.
when they go on holiday and when they work.
But people who are insecure, that was another big finding of mine, were inclined to go to work when they were ill.
Okay, what about gender? Was there a difference? Are women more or less likely to exhibit presenteeism to go to work when they're ill?
That's a good question. In my study, they were not. Women are more inclined, and I've done a fair amount of work on this, trying to sort this out, more inclined to be absent than men, at least in Western cultures. It's a pervasive finding.
Some of the reasons for that would be...
This gets complicated.
Yeah.
Let's just
I
say...
imagine taking care of children, for example, could
yeah, except the research is inconclusive about this, frankly. The double burden hypothesis, there's no doubt that women suffer from a double burden of working and having more family responsibilities than the average man. But the research doesn't seem to implicate this so much. So it's a lot more about how people deal with those responsibilities that affect this. In terms of presenteeism, in my study there was no difference. And in some research, there's a slight glimmer that women may report a little more presenteeism than men. But overall, I don't think there's nearly the difference for absenteeism.
In your setting, would you say, have you seen men trying to be more tough, or would you say you try to be just as tough when you go to work?
I was going to object to that.
Please do.
But so I'm thinking, I think depending on the positions, I think, from your professional positions on, I would tend to think there's no real difference in gender between men and women. I think people are striving for better job opportunities. They're striving for promotion. And I think, women need to perhaps prove themselves a little bit more. I know I perhaps sound antiquated, but I still think that's what's going on today. So as a result of that, I tend to think that there's a lot more sacrifice being put by women than there is by men. I'll give you an example. There are some work cultures where, if the man is staying after hours, whether or not there's work, that's debatable, so there's your presenteeism. Whether or not there's enough work to justify them staying after work, they will stay after work, especially in the management. I see that more in the management team. Where, if your boss is a male and he's staying there after hours and you report to him, well, maybe you're going to try to leave perhaps a little bit before him, but, you're going to stay to show...
FaceTime, as they say.
Yeah, you're going to stay just to show that, you're just as committed as he is, you're just as loyal to the organization as he is, and it tends to prove that, wow, you've got a lot more work on your hand. Whether or not it's true, that's a different story. So I think women still fight with that. So I don't know if that's necessarily the case.
Another avenue for research, perhaps.
Indeed.
We've talked about gender. What about personality? I mean, some people are workaholics. Some people value their work differently. Some people put their own priorities elsewhere and perhaps towards their family. How does personality impact presenteeism?
One feature I measured was emotional instability or neuroticism. These aren't full-blown neurotics, it's just, this is within the normal personality range. And I thought for sure neurotics were going to report going to work when they were ill, sort of negative.
Right.
In fact, they reported less, and I couldn't understand it. I talked to a doctor friend of mine, and she said, it's obvious. She said, people who are neurotic are very concerned about their health. So yeah, exactly. I also found locus of control, how much control you think you have over yourself, internal locus of control. Those people, I thought they would be able to feel that they could go to work in their because they could manage themselves. Evidently, no, these internals felt they aren't going to do this. I'm in control of my health. I'm not going to work when I'm ill. So a little bit, some surprises in the personality domain. You brought up something about work and family. I did find that people who reported a lot of work to family conflict, this is conflict where their work life kind of affects their family. Those were also the people that reported engaging in a lot of presenteeism, right? So that almost tends to follow. So yeah, there are these individual differences between people as well as differences this is why we have to look at every aspect of this, at the person at the job, in order to understand the whole configuration of these attendance dynamics.
Now we've talked about personality. Can we look at the impact of presenteeism? So going to work when you're sick, what impact does it have on you? Can we talk about what impact it may have on the employer and on the economy? First, on the employee, him or herself, what impact?
Some research has shown that extended presenteeism predicts absenteeism downstream. That is, if people continue to go to work ill, and of course this would probably apply to certain kinds of causes, medical causes, but this is a precursor to absenteeism. So sometimes an occasional absentee day can serve as kind of a safety valve, get you back together and everything work out all right. So from that point of view, that's one downside. On the other hand, as Gina's been talking about, presenteeism might indeed, if you take a more social view of the whole thing, might garner you some points with other people. This is seen as a form of organizational citizenship behavior, going above and beyond, not letting your team down, supporting your boss. And it may be that people who do this indeed garner some kudos from the social network in the organization. So there's a couple kind of contrasting views.
Or at least a perceived culture, right? I mean, we don't know if the brownie points are there, but there may be a perception that this is better for me if I do it this way, or if I come in if I'm sick.
Mm-hmm. Let's talk from the employer's perspective now. What impact do you think presenteeism has on the employer, on the hospital, on the company? Should people come in when they have a cold? Should they come in when they have the flu? Right.
After reading Professor John's research, I'm questioning myself on that. I do realize that there is a huge financial burden on the organization. Apparently, right, according to your literature, much more on presenteeism than there is on absenteeism, which is something that really took me aback.
So you mentioned financial burden.
Right.
Do we have any numbers in terms of how much this impacts businesses?
Well, we do. If you take absenteeism and presenteeism and add up the productivity loss, a lot of studies show it's kind of like an iceberg. The small amount is above the water, that's absenteeism. The big part, which is kind of hidden, is the argument here, or the analogy, because it's harder to see this because you can't quite count it, appears to be presenteeism. So every study I've seen indicates that at the organizational level, there's a lot more productivity loss due to presenteeism than due to absenteeism, because people feel kind of obligated to go to work, and presenteeism, they do this a lot more, so they're partially productive. On the other hand, as Gina noted earlier, at least you're getting that productivity out of them. If that were converted to absenteeism, you'd have a big problem. But to return to the argument is that a lot more productivity is lost due to presenteeism than due to absenteeism, because there are a lot more people engaged in a lot more partial productivity
and I
who are
think
presentees.
Maybe just to go back to your question, if that is the case, and I don't doubt that it is because you've done the research, then that's very costly to an organization. And maybe the organizations need to start looking at presenteeism and what it costs them to have employees who are present but not necessarily productive, or maybe not as engaged as they should be on the workforce.
Absolutely. And in terms of the money lost, we don't have any numbers here for Canada, but in the United States there have been some numbers, some figures that have come out, in particular in the Harvard Business Review.
Yeah, there was an article by Paul Hemp that estimated that presenteeism in the U.S. cost $150 billion a year. So that's a lot of money, and it's much more money than I've ever seen cost attributed to absenteeism. So from that point of view, I don't know whether that number is true, but the number is big, and we know that this is an issue.
I think it's interesting to talk about the people who fund these studies. A lot of pharmaceuticals funding presenteeism studies. None in your case. You were funded by a federal institution here in Canada. But there is an argument that pharmaceutical companies will sell more products, more medicines, if the numbers of people who go into work sick go up.
Yeah, my research was funded by the Social Sciences and Humanities Research Council of Canada. A lot of the productivity loss research in presenteeism, the research where they ask people to check which illnesses they have and then look at how much productivity is lost to the various kinds of illnesses. That's how these studies are done. Almost 100% of those are funded by pharmaceutical companies. In and of itself, there's nothing wrong with that, but it does provide some incentive to generate high numbers due to productivity loss, because some other reparations could be argued to be state-of-the-art medicines, that if the Quebec government approves, or if Concordia University approves on their health plan, or the MUHC approves this particular pharmaceutical product, if you can make a productivity claim, you're more likely to have that product listed. So there might be some incentive here. The bigger point, however, is even among those studies, there's a tremendous variation across these studies in how much productivity loss is occurring. So that indicates we don't know how to measure this very well. Even the low numbers are big. So even I guess it's a best or worst case scenario.
Yeah,
I don't know.
yeah.
This is still a lot of productivity loss.
Yeah.
And it goes up from there in other studies.
I'd like to finish this conversation by thinking about the future and how looking at presenteeism may change the way organization work. For example, I'm thinking about being more flexible about how people work from home, for example. Is that something we can envisage? How could companies change in terms of looking at presenteeism?
I think the onus at some point needs to be on leadership and on the management practices, because we know that employees tend to leave managers and not organizations, right? So you have employees who, if they're going to work and they're ill, managers tend to know that. So how do we make managers aware that this is a problem? How do we train them to support their employees? I think there's a whole education that has to be done for management, because they're frontline with their employees. So there could be other aspects that we look at, but I firmly believe that managers probably hold a big part of the key, and I don't know if you'd agree with me, but a big part of the key to helping deal with this presenteeism issue.
I absolutely agree with you on that. I think that we need to get the interest of top managers galvanized by this issue. I think Hemp's Harvard Business Review article was an attempt to do that, because senior management read this a lot. Right. To be able to say that this is a legitimate thing for us to be studying, and then allow people who are a little more inclined to work out the nuts and bolts, such as top HR managers, to develop this issue. But I think that ultimately most of this probably does have to be played out down more at the line management domain, because these are the people who know the employees and understand their particular needs and issues. I think your point about, for instance, allowing a little bit of job redesign, even in the short term, there are a lot of people who have old jobs that could easily, that don't work at home, but could easily work at home a few days and might sort things out. I think we need to open up a discussion about this. We need some policies, but we also have to have an open discussion that provides first-line managers with more kind of support and autonomy to make some decisions. But first we have to introduce this subject and talk and let people understand why we're interested in this. This might allow then some of that productivity loss that occurs with presenteeism not to happen, not to be so bad. Sometimes it's something as simple as the commute that kills you. In other words, you're not feeling so well. If you didn't have to drive in from Hudson to Montreal, everything would be okay, and you could stay at home and work for that day. Now, this doesn't apply to all kinds of people. We alluded to that before, but it applies to more people than typically we think about occasionally giving this opportunity to.
It's a real challenge.
Gary Johns, Gina Rizzo, thank you very much for your perspectives, and thank you for coming in. And thank you for watching Beyond the Headlines. I'm Caroline Locker. Bye-bye.